So, as Kylie said today, I'm going to talk about nurses and antimicrobial stewardship. And the, can I just check that everyone can hear me? Okay. Doesn't sound like a microphone up front here, but can hear? Yep. Okay, good. All right. So, nurses and antimicrobial stewardship. And the title of this session, I think, is actually Challenges and Opportunities in Antimicrobial Stewardship. So, I guess I'd like to start by saying I see nursing involvement in AMS as being an opportunity rather than a challenge. So just to set the scene. So I'm going to go through over the next 15 minutes, hopefully, a little bit of a brief background about nurses and AMS, like the story so far, talk very briefly about some findings from the literature and give some perspectives on implications for practice. Now, Kylie mentioned that I do work part-time for the Commission, but I really just want to emphasise that today I'm here speaking in my capacity as a researcher with the National Centre for Antimicrobial Stewardship. Okay, so what is AMS? So we heard a little bit about AMS this morning. We've certainly heard definitions. I just wanted to start by a more recent definition of antimicrobial stewardship that was published in the Clinical Microbiology and Infection Journal just not that long ago. I haven't got the month there in front of me, but not that long ago. And that was by Dyer and others on behalf of the ESGAP group. And they talked about in this paper about perhaps a new definition of stewardship being required. So they talked about perhaps traditional definitions of stewardship weren't really all that encompassing and reflective of what stewardship actually is. And said, you know, perhaps traditional definitions had focused more on the tasks of stewardship, but didn't reflect some of the broader perspectives and were not necessarily easily translatable to different languages and also to different groups. So I quite liked that perspective as a nurse. They came up with a definition that they said was a coherent set of actions which promote using antimicrobials responsibly. But they also talked about the actors in antimicrobial stewardship. And they said that the specific actions for stewardship really depend on the actor, and that different actors, and that could be individuals or organisations or governments, really could be good stewards. And they talked about an older definition of good stewardship. So they talked about us all as being good stewards, and then they said that individuals and organisations could think about the definition and how they could translate that into action. So on that note, let's just think about these many different actors in antimicrobial stewardship. So AMS is multidisciplinary. Certainly one of the definitions talks about that. Nurses are the largest percentage of the health workforce, and just to give you an idea of what that actually means in Australia, we have close to 300,000 nurses registered in Australia. We have around 90,000 medical practitioners and around 25,000 pharmacists. So that sort of gives you an idea of how big that nursing workforce is. We know that the nurse is a constant presence on the patient journey, not just in the hospital setting, but increasingly in the community setting. And we know that antimicrobial management, if you like, fits with nursing practice, because nurses, you know, they assess patients, they give prescribed medications, they monitor patient responses, they talk to patients about the medications they're receiving. So it's odd that nurses have really been mostly overlooked with regards to stewardship. Now, the nursing profession have made some, put forward their views about the role of nurses in addressing antimicrobial resistance. The first position statement really came, I'll just go to the bottom row there, that I could find really came from the Australasian College for Infection Prevention and Control. But that was around the role of the infection control practitioner in addressing AMR and in AMS. Now that statement was revised in 2017. Now I'm not just this year, so I'm not really going to focus specifically on the role of the ICP today. I am talking about nurses, but I did just want to highlight that. So with regards to nursing, the Royal College of Nursing in the UK came up with a position statement in 2014. Recently this year, the American Nurses Association, in conjunction with the Centres for Disease Control, came up with a white paper where they talked about the RN role in hospital antibiotic stewardship is actually what they called it. And also this year, the International Council of Nursing have come up with a position statement on the role of nurses in AMR. And that statement at the bottom there, which says nurses play a central role in patient care and interdisciplinary communication and are in a key position to reducing AMR and are critical for the function of antimicrobial stewardship programs. That really is a statement that's reflective of all of the other position statements there. Okay, but what about what's happening in terms of the literature? So there have been quite a few opinion pieces or educational pieces written about nurses and antimicrobial resistance or nurses and antimicrobial stewardship. And the general view from these pieces has been that nurses they've highlighted this constant in the patient journey. People talk about nurses knowing the patient best. They talk about nurses being a trusted professional group. They talk about nursing values of patient-centred care and bringing a different perspective to AMS. They talk about knowledge and skills. They talk about the central coordinating role of nurses in hospital settings. And they also talk about the capacity of nurses to influence prescribing behaviour. And that has been demonstrated through the research, and certainly industry recognises that influence. Now, more recently, there's been a literature review published by Elizabeth Monsies from the United States. Now, I am what's classified as a young researcher. Isn't that exciting? So I've only been doing this for 12 months and I'm part-time, so technically I'm 6 months in, but yeah, people have said, you should enter one of those young researcher awards, and I think, well, how exciting. Okay, so it's disappointing when you're a young researcher to see someone else come up with a literature review where there's been nothing before on the topic that you're researching. Nevertheless, this paper looked at 13 studies from 62 potentially eligible ones. They focused on acute care settings, and they came up with these major themes around nursing knowledge, education and information needs, and also around patient safety. And they also highlighted the lack of the nursing presence in the AMS research. And they highlighted that while tactical skill development is important for nurses, there's also this need to strengthen interprofessional collaboration. Now, my research has gone a bit broader than Monsies and her colleagues have done. I think because this is a new area, there's an opportunity to look at nursing across the spectrum of care to encompass primary care and also aged care. And I think we could probably learn a bit about nurses in all settings and how that might be applied in different contexts. So I'm very early on. I don't really have any good hard data to share, but I'll talk about some of the themes that I've found, and they're listed there. Okay, so perceptions of the role is a theme for me, how nurses feel about AMS and their role in it. The need to provide them with knowledge to support them in their antimicrobial stewardship participation, how to facilitate engagement, their influence on prescribing, these values of patient-centred care, and potentially maybe some tension for nurses in supporting AMS strategies. And that might come when nurses are perhaps trying to administer restricted agents to patients and trying to get approvals. Now, just on this lack of research from the nursing profession, I've just made up this little graph here very quickly just to show you how little nurse-led research there is. Now, if you do a quick search on antimicrobial stewardship in PubMed, you'll get what? For just 2017, perhaps, you'd get maybe 600 or so papers, okay? So I looked from the beginning of time, if you like, and just did a quick, nurses and antimicrobial stewardship and a couple of other terms in there. So from the papers that I found, narrowed it down, and then narrowed it down again to 25 eligible papers. Now, of those, only 7 were led by nurses. So that's not very much, okay? So a very small percentage. And just going back to that, most of those were in acute care, but there were 8 in aged care, but only one looked at, that I could find, looked at nurses and midwives in primary care. Okay, so one of the themes, I'll just touch on 4 of the papers just to highlight some of these themes. So this first one was a study undertaken by NHS Scotland. It was published by McGregor and the other authors in the Nursing Times in 2014, but the full report is on the NHS Education for Scotland website. So they surveyed all nurses across all 14 Scottish National Health Service boards in 2014. Now there's a workforce of about 67,000 nurses and midwives there. And they got 900 respondents. So I suppose technically a limitation of this study was the response rate. But as a nurse, sending out an electronic survey across all hospitals across even a state or a territory, I think that wouldn't be too bad. I'd probably be quite happy with that. There are 171 work sites. Now, 48% of those nurses who responded were working in acute care settings, and 45% were working in primary care settings or community care settings. Now, 1 in 5 of them had heard of AMS, and they perceived their role mainly around ensuring appropriate use, ensuring education for colleagues and or patients, and just over 10% thought it was about challenging prescribers. And I just put that there because I think sometimes there's a misconception that people think, oh, nurses always want to spend their worry about, challenging people. The main challenge they saw to their participation was lack of time due to competing workloads. And they saw that the type of the support that they would need would be education. About 20% of them would like support from experts or mentors, and 37% said from senior leaders or colleagues. Now, earlier this year, Multidisciplinary and others published a study undertaken in New South Wales across 3 public hospitals. There were 2 hospitals of about 600 beds. One of those had paediatric units, and there was a 170-bed children's hospital involved in this survey. And they adapted the survey that was used in Scotland to survey the nurses in those settings. Now again, and of note, the 3 hospitals involved all had electronic clinical decision support systems in place. So they all had AMS programs going on. Now, the results there, low response rate again, 142 nurses out of a potentially eligible. Can't see my notes on the screen, so I've actually forgotten. Doesn't matter. Can't remember the potentially eligible number, but I think it was like 4,000 maybe. I'm really sorry about that. But the response rate was low. But notwithstanding that, about 75% of them expected that nurses might be involved in AMS. About 60% said that their knowledge of AMS was limited. They saw their main roles as being, 86% of them saw their main roles as being around infection prevention and control and hand hygiene, and about the same number saw patient advocacy, just highlighting that again. And the other responses are highlighted there. One thing that came out in that particular study though was that people saw support from nurse educators and nurse prescribers as well as pharmacists being important, and also support from the AMS team. Okay, now the next study was a study by Alex and Jennifer Broom and others. This was published in 2016 in Qualitative Health Research, and in this paper they looked at the role of nurses as knowledge brokers in hospital settings. So, and brokers, if you think about someone who helps, explain something to you, just that's in very simple terms about the terminology of broker. So they interviewed nurses in a range of clinical units from 2 hospitals in a major Australian city. The interviews were semi-structured, there were 30 nurses involved, and they all had a range of experience. How am I going? 2 minutes? Oh God, heaps. Okay, so, and they used a qualitative methodology to analyse the results of the interviews. So the themes that came out from that study, or the themes that were highlighted there, were the immediate concerns of nurses, as has been shown for medical staff too, about doing the right thing for the patient, but in the nursing context about getting the antibiotic treatment to the patient. The thing that came out there was that sometimes nurses would use so-called black market systems to try and get restricted agents, even when they hadn't been approved for ongoing use, to get them to the patient. And they were doing that in what they saw as their perceived benefit, to be for the perceived benefit of the patient. What also came out in that paper was the considerable influence that nurses may have on prescribing, but that can sometimes be constrained by the context in which they work. So their own expectations and the expectations of others around their role. So, i.e., a nurse can go so far in asking questions about antibiotic prescribing of the prescriber. And the authors said, that any strategies to optimise antimicrobial prescribing should explore the experiences and the values of nurses and think about how this might be applied to implementation. And now the last one I'll look at is an intervention. Now there were very few interventions of the research papers. There were 6, actually. And there was one in acute care, and it was this one by Elizabeth Gillespie that was done in 2010-11. And it looked at an IV, implementation of an IV to oral switch program targeting senior nurses through education. And this paper, I have to say, Elizabeth, I don't know, Elizabeth, is Elizabeth here? Or anybody who contributed to this? No. Elizabeth should be very proud of this paper because it's cited in... She's not here. Yeah. Oh, Glenda. So, because it's cited in almost every single paper I have read about nurses and antimicrobial stewardship, so there you go. So there were 79 nurses who were involved in the post survey. Very quickly there, if you look at the beginning of this, at the beginning of before the education program, nurses weren't able to talk about what antibiotics their patients were on. Only half of them were able to state the duration. And the rest of those points there, I think, that are really important are the fact that prior to the intervention, they would question an antibiotic order if they thought it was inappropriate. But going back to that first one, were they actually able to recognise if prescribing was inappropriate? So I guess the summary there is that the education intervention really made a significant difference to nurses' knowledge. So what does all this mean? And I'm concluding. What this basically means, I think, or what I'm taking away from what I've read so far, is that certainly nurses can play a practical role in antimicrobial stewardship, and it's relevant to their practice. So there's medication management, there's infection prevention and control, there's taking specimens for culture, and there's patient education. But I think it's actually something more than that, that's not sort of really clearly articulated in the papers, and I think that's around the comprehensive care that nurses provide, their comprehensive nursing knowledge, and how that works and integrates with AMS is yet to be sort of fully explored. I think also the coordinating role that nurses have has to be looked at, and it all links with nursing values. The key to engaging nurses is really about nursing values around patient-centred care and advocacy. Okay, so support for them to engage, thinking about the broader context that they work in, think about engaging nurses and leaders in how that works, and that seems to be something that's overlooked a bit. Sometimes it's how do we engage nurses but the nursing leaders aren't involved. Education and also behaviour change. And there are some implications for future research, but I don't think I've got time to discuss those. I would like to just say, perhaps we can think about engaging nurses by talking about, patient-centred stewardship, because that is something that will resonate, and I'm sure it resonates for many of us here anyway. And thank you. Oh, sorry, Mr.